Uh, Good evening, dear student. Today's topic is arsenicosis, and I think you know well about the arsenic, uh, about arsenic manifestation, especially health effect of the arsenic in human body. I think already you know something, and this is our globe, and in this present time, you know well that all the world is now suffering from pandemic, and this disease is named is the COVID-19. And you know well that still now we are not actually sure how this disease spread whole world. But one thing the scientists agreed that uh, this disease is created due to environmental, mainly environmental pollution. In especially in China, in Wuhan, the people was the very closely related with the some wild animals, especially in this corona, the bat. I think you know one kind of bird. So this bat in fact contains many type of virus, and even in many types of coronavirus, etc. From this bat, this virus ultimately come into human body, and then ultimately it is spread now from the China, Wuhan, China to all over the world. So environment, health, and disease, these things are very closely related. So arsenic is this one of the example of the disease which is related with the environment. You will see this is the very nice a natural scene, but a nature is consist of its water, its earth, its air, and everything must be clean for a very healthy life. But if you compare in many historical place, you will see one of the place in 1985, one of the mountain was covered by ice. Now in 2002, it is the picture of 2002. This is a no ice, and same our sea level is becoming sea level becoming increasing. In 1999, there was one sea level. Now it is the another sea level. Just like that, many things are changing day by day, and our human ultimately day by day are in the suffering of the many things due to environmental pollutions. And arsenic, what is arsenic? It is a natural component of the earth crust, and it is found everywhere, including atmosphere, soil, rock, water, and many things else. In the rock, its level is 1.5 to 2 milligram per kg. In contaminated soil, it is up to 500 milligram per kg of the elements. And mostly important is the natural water, where it is level is actually safe level is still we call it is zero point 0.1 to zero point 0.4 microgram per liter. This is the important, because we are in fact suffering from the mainly from natural water. And historically about arsenic, it is very old things, especially 400 to 500 before the birth of Christ. This was used for therapeutic purpose in Greece and Rome. Even Hippocrates used it, and many other historical persons used it. And you know well, one of the Arabic scientist, alchemist, he first time discovered arsenic oxide. It is, and he suspect it is like poison. And 1822, arsenic was identified as a possible carcinogen also. And historically, you will see that it is in fact one kind of king of poison, because it is colorless, odorless, tasteless. And it is called that Roman Emperor Britannicus was killed by arsenic in 55 AD. Even Emperor Napoleon was reported to be killed by arsenic. So, arsenic is a very important compound, and mainly there is a two type of arsenic compound. One is the inorganic, other is the organic. Among the organic, it is the one is the trivalent, another is the pentavalent, and organic it is the monomethyl arsenic acid and the dimethyl arsenic acid. And in the human history, the first detection of chronic arsenic was through drinking water, and it was first time we observed in 1917 in Argentina, and cause in our subcontinent, though actually arsenic in Bangladesh, especially we think it is due to natural erosions of especially Himalaya mountains. These rock eroded sediments migrate through the three main rivers, especially in Bangladesh. And we exposed to arsenic by consuming contaminated water, eating contaminated food, even breathing contaminated ambient air. And two type of main type of toxicity, arsenic toxicity. One is the acute toxicity, and other is the chronic toxicity. Acute toxicity may develop by ingesting 1 to 3 milligram of arsenic per kg body weight at a time. That means around if a healthy person weight is 70 kg, so if any person take 200 milligram of arsenic, it will be very much toxic. Even who take suicidal attempt usually take this amount of arsenic, and it is the king of poison. So who actually commit suicide, they are using it. And after taking this arsenic, within 30 minutes, it developed severe vomiting, passage of rice, watery stool, abdominal cramp, muscular cramps, anuria, coma, etc. But our concern is that chronic toxicity, and it usually take 2 to 10 years exposure to become in fact, to develop the arsenic toxicity. So, most importantly, now we use the term arsenicosis, and it WHO give a definition. This definition is important to you. Sometimes we ask this definition in examination. Arsenicosis is defined as a chronic condition arising from prolonged ingestion of arsenic above safe dose for at least 6 months, usually manifested by characteristic skin lesions of melanosis and or keratosis without involvement of internal organs. So this definition is very much concise and clean. It is must be a chronic condition and must be due to prolonged injection of arsenic above safe dose, and minimum the exposure time must be at least 6 months. So in Bangladesh, the history is very interesting. You know well that at the time of, especially in 1970s, Bangladesh had one of the highest infant mortality rates due to ineffective water purification sewage system. Millions of wells were constructed then as a result. Because of this action, in fact, our gain was that infant mortality and diarrheal disease were reduced by 50%. And around 8.4 million tube well was in fact built in our the villages and all the community level. And at this moment, we are observing that among these 8.4 million wells, approximately 1 in 5 of these wells is now contaminated with the arsenic. This is very bad sign for Bangladesh. Around 20% of our tubules are arsenic contaminated. And in the community level, you will see in many villages, our public health department marks the tubule which is arsenic contaminated or not. This they colored red of the tubule which are the arsenic contaminated, and colored green which are not arsenic contaminated. So if you see that the common tubule which are in fact installed in our village level, which is actually uh, not so deep. It is mainly between 20 meters and 100 meters area of this our ground level, and this level is in fact arsenic contaminated. Though in fact the ponds or the dug wells which is not so deep are not arsenic contaminated. Even deep tube well which is the more deep than 100 meters, this is also not actually arsenic contaminated. And in our country, our population, you know well that now our population is around 16 crore, and among this population around 28 to 35 million people are exposed to now arsenic contaminations. And who are arsenic contaminated? Who are drinking water which arsenic level is 0.05 milligram per liter. And in USA, their safe water level is not the same to us. Their safe water level is below zero point zero 0.01. In our country, our safe water level is increased up to 0.05, and this is very important because we just fixed our arsenic level water is 0.05, but still our around 35 million people are drinking this amount of arsenic every day. And what about the skin conditions? Up to now, around 40,000 people are showing the skin lesion, which is characteristic of arsenicosis, especially in Bangladesh. And what are the skin symptoms? Uh, Mainly two types of skin symptoms we observe in the arsenicosis patient. Number one is the pigmentary changes. Pigmentary change means on kind of dark spot in skin or the mucous membrane. So two type of skin pigmentation. One is the melanosis, another is the leukomelanosis. Melanosis is the fine freckled or spotted hyperpigmentation pattern on extremities mainly, sometimes diffuse or generalized pigmentation, sometimes localized or patchy pigmentation, generally all over the body. Leukomelanosis is that it is the in fact the rounded hypopigmented or depigmented macules on a normal or hyperpigmented background. This is the pictures of the spotted melanosis. You are observing here the black pigmented in the trunk of a young patient. This is another picture of spotted melanosis. And this is a case of leukomelanosis. You'll observing the whitish spot among the deep pigmentation. Here, both hyperpigmentation and within the hyperpigmentation area, there is a very little dot of the depigmented spot. So this condition is called leukomelanosis. This is another case of leukomelanosis. Another common condition of the arsenicosis is the hyperkeratinization. Hyperkeratinization means hardening of the skin. Another way we can say that keratosis is the thickening of the skin and appearance of papules or nodules that can both be further subcategorized as a mild, moderate, severe. The lesion, which is thickened but the papules are less than 2 millimeter on the palm and sole, is called the mild type. In moderate type, it is the multiple raised keratosis and its diameter usually between 2 to 5 millimeter. And in severe case, that is the keratosis infect is widespread and individual papule or plug is a bit more than 5 millimeter in diameters, and usually we see it in palm and soles, and sometimes it look like what like, or sometimes it look a horny appearance. Sometimes diffuse thickening of palms and sole alone or in combination with keratotic nodules. You will see the some pictures of the keratosis. This is the a picture of the moderate keratosis. You are seeing that there is the uh, keratotic patches. It is the another keratotic patches. This is the small keratotic patches. This is one kind of severe keratosis of palm, and you will see that this this is a one big patches. This is one very big patches, and definitely it is more than 5 millimeter in diameter, and this is called the severe keratosis of the palm. And another picture in the sole, you will see that very widespread lesions. It is spreading almost all the sole of this patient. Another picture, that is the severe keratosis of the palm, and almost all the palm is now here is involved. So this picture is mostly very much characteristic of arsenicosis. In this picture, you will see that this is the nodules are more clear here. You can identify that is some pigmentation also in this picture. So the main two condition of the arsenicosis is one is the melanosis and one is the keratosis. And other complications, there is a lot of complications among fewer. One is the non-picking edema, another is the peripheral vascular disease, other is the chronic ulcer, another is the Bowen's disease. It is a one of the pre-malignant skin condition. Squamous cell carcinoma, basal cell carcinoma, hepatopathy, nephropathy, cancer of internal organs like urinary bladder, lungs, prostate, etc. Adverse pigmentary outcomes, diabetes mellitus, hypertension, etc. This is one pictures of non-pitting edema of leg. This is a Bowen's disease. You know well that it is a pre-malignant condition. Subsequently, it may develop into squamous cell carcinoma. This is the gangrene of foot. This is another picture of the gangrene of foot. This is the squamous cell carcinoma of the skull. Here also the squamous cell carcinoma in palm. This is the carcinoma of the lung. So you know well that in fact the health complication of arsenic is really widespread and sometimes it is very serious. And the social impact is more. Some people believe that arsenic poisoning is in fact contagious or curse. Even some people are reluctant to let their children to play with children suffering from arsenic poisoning, but actually it is not the contagious disease. You know well that. So how actually in fact we shall diagnose this case? Number one, we should take history. If history of exposure, that history of consumption of arsenic contaminated water, that is the 0.05 milligram per liter for at least 6 months of history, this is important to diagnose the case of arsenicosis. Even we can measure the arsenic level in nail, urine, hair. In nail, actually it is the 1 milligram per kg of amount of nail. In urine, uh, it is 50 microgram per liter, and it is here like it is nail 1 milligram per kg. So regarding the management of arsenicosis, we know well that it is the environmental problem. So prevention is the main treatment of arsenicosis. We must be Our drinking water must be safe. Our drinking water must be arsenic free. But it is really difficult in our country to get arsenic free water because our almost one third our tube well, which is the most mainly our the main source of water consumption, is contaminated by arsenic. So we have to find way to get the safe water. So first measure to prevent arsenicosis is the stoppage of the further intake of arsenic contaminated water. And second is the some supportive treatment. I shall discuss this supportive treatment later on. And another way is to increase intake of available proteins and vitamins rich vegetables. And easily you will see that in where there is this keratosis or hyperkeratosis. In this case, we can use some keratolytics, some keratolytics cream or ointment is the salicylic acid or the topical urea cream, etc. And most importantly, we have to treat the uh, manifestation of arsenicosis, which are the sometimes melanosis, sometimes severe condition like squamous cell carcinoma, etc. And we shall take specifically this carcinomatous condition. And at the present moment, we treat the mild to moderate case of arsenicosis by oral vitamin like retinol, beta carotene, ascorbic acid, alpha tocopherol, selenium, spirulina, zinc in our country. Few studies already we have seen that spirulina is actually working good in case of arsenicosis. However, this treatment with this antioxidant actually required 4 to 12 months, and prolonged duration of treatment influence the compliance and treatment cost. So this is the impact, the in short of or not in short elaborately, I have described what is the arsenicosis, what is the type of arsenic, what is the health manifestation, what is the dermatological manifestation of the arsenicosis, and what is the mode of treatment. So I think in our country, arsenicosis, in fact, it is one of the very big health complications. In world media and all over the world, people know that Bangladesh and part of India is the uh, very much it is a well discussed matter that in this region around 8 to 10 crore people is suffering from a very big poison, that is the arsenic. So in our country, especially our dermatologists, our physicians, our health workers must know what is the arsenic, what is the arsenicosis, what is the safe water level of arsenicosis on water. So I think for every student must will know the basic of this arsenic and the arsenic related disease, that is the arsenicosis. So thank you very much. And I think I shall meet you in the next class. Next class will be on acne. Thank you very much.